So we moved lectures a little bit around because that's okay, it's fine. So what happens is, this afternoon, can you hear me well? This afternoon, you're going to have a graft evaluation, tissue evaluation, and we kept that as a critical thinking for tomorrow. So we decided to move lectures a little bit around so I can give you a little bit of critical thinking regarding tissue evaluation so that you have something to work with this afternoon during the lab time, okay? I'm going to have 3 lectures, one back to back. The first one will be about operative flow, and I'm talking about the FUT procedure, strip procedure. This is our operating room. The day before the surgery, I set up everything where the packages are put on a table. There's a main kind of setup, but nothing is open, like any other surgery, right? The morning of, I arrive at 6:15 in the morning, and until 6:45, I'm setting up. There's a nurse with me, we mix medication, we prepare things, and the patient shows up at 6:45. So I have about 30 minutes to set up everything and get ready. The patient comes in, and then when the patient is in, then I prep the patient, prepare the donor area, bandage, then shave if it's a FUE procedure. Sometimes we ask the patient to shave their heads, zero guard on a razor, or we ask for high and tight like a military style, or some patients ask us to shave their heads. We never do partial shaving. Some areas will just create a window. We either shave entire, and it kind of looks, for us, looks easier for them. They don't have to worry about retrimming it later. I prepare PRP. We do PRP on every patient that we do surgery on. We do PRP. So the PRP would be prepared, and while this spinning, Dr. Lam now arrives and he designs the hairline, and then we're ready to move on. The next thing, Dr. Lam, after designing hairline, discussing with the patient, we do, on our strip surgery cases, we do IV sedation. So the first thing will happen is, after discuss the hairline, we start IV and then the anesthesia. So Dr. Lam is the one injecting anesthesia. The strip is out. We take out the 2 centimeters first, and then we start slivering and dissecting. By dissecting 2 centimeters and by measuring the total length of the strip, we project how many grafts we're going to get out of the strip. So the first 2 centimeters are removed. We start dissecting, slivering. Dr. Lam is still continue to remove the rest of the strip. Then while he sutures, we are continuing to dissect. So we have 5 assistants. I'm the one slivering, and we have 5 assistants dissecting grafts. So I'm talking about, let's say, a long case. I put the time here, that there's a different time is if it's a shorter case or a longer case. So let's say if it's a 3,000 graft case, Dr. Lam will finish suturing by 9:30 and then making sites by 11:30. Usually around the same time we finish dissecting grafts. All the grafts are collected. We put the PRP on our grafts. We all break for lunch, and then we all come back and start placing. So during the placement, we usually have, if we started, sometimes if Dr. Lam finishes early, we may start placing before lunch. And then depending how big the case is, let's say 3,000 case graft will finish about 5 o'clock. So it's a long day. We're always 3 people placing if there's a room for 3 people, and then we rotate. We place from 1, for example, from 1 till 3, the same 3 assistants, and then at 3 o'clock we start rotating, taking 30 minutes break, and then we continue till the end of the case. At the end of the case, we bandage only the patient who received FE procedure, but not the strip procedure. In strip procedure, we clean everything, blow dry hair as much as possible, looks normal, and the patient leaves without the bandage. Our patients, since they're all received some sedation, they cannot drive after they need to be picked up. They will come back the next day to follow up with us, and at that point they can drive themselves. And then there's a cleaning and sterilization. So after we finish dissection, one of the assistants, since there were 6 of us, now there's a 3 assisting in hair restoration while one is floating. The one that is floating is going to clean the instruments. Then the other two move to work as a MA. And then the one that is floating will start relieving and kind of rotating in placement. And at the end, all four of us will clean the sterilization. Does that make, and do this, prepping the instruments. So you have this presentation available to you after the meeting. So this is the approximate time. There's a lot of things listed in the morning. So I arrive 6:15, and then usually by the time everything cleans, it's like a 12-hour day if we do a big case. Anything smaller than that is normally shorter day. I'm going to move to the next presentation.